Speech and language pathologists, or SLPs, work with any person across their lifespan with any communication and swallowing disorder. Most speech-language pathologists work in the school setting. Speech pathologists also work in private practice, hospitals, rehab facilities, in the academic setting, outpatient clinics. Referring to a speech-language pathologist can be done in many different ways. Let's go through the lifespan of a person. From ages 0 to 3, a child can be referred by a family or by any other clinician to the early intervention program, and you can find a local, usually 1-800 number in your immediate geographical location. Once a child is school age, ages 3 and up, a child can be referred through their school district. I get to see pediatric dentists a lot on the craniofacial team. In my career, outpatient, I've had referrals from pediatric dentists for children that may have short frenulums, or children with tongue thrusts, or children with particularly any speech production issues related to any structural anomalies of the teeth. I also think that speech-language pathology and pediatric dentistry can work together in terms of counseling and screening when a child is in mixed dentition, in terms of what to expect or how to work through any speech sound changes during those years. And you know, the pediatric dentist is seeing children so regularly in an optimal relationship, more than once a year, at least 2 times a year, that it's a nice relationship to foster should the pediatric dentist notice that the child isn't developing the way they were, the child maybe is stuttering, the child maybe has some vocal changes, is difficult to understand. So those are the areas that I also see working with pediatric dentistry. Speech-language pathologists often get referrals from pediatric dentists from children that might have a tongue thrust, might be protruding their tongue when they're making certain speech sounds, protruding their tongue when they are swallowing instead of bringing the tongue backward into the oral cavity to initiate the swallow. And there are exercises, functional exercises that we can do to either strengthen muscles that might be hypotonic or retrain the child behaviorally what to do for improved speech and or swallow outcome. So oftentimes children may have prolonged use of pacifiers and or bottles, which can impact the oral structure and impact speech. So I have worked really with the behavioral plans for families to wean the bottle and the pacifier by having a party to get rid of them, or doing positive token reinforcement. And a speech pathologist, is trained to work on some of those behavioral goals as well, so that you can then bring in the more related speech or language or swallowing goals. But there are so many just day-to-day rewards, when children and adults and their family and caregiver see growth and improvement in self-esteem and their ability to communicate and navigate their relationships in their world.